Hello everyone, I'm Angeline Killen and my presentation is on end of life care and palliative care. So there isn't much of difference between these two populations because one starts from palliative care and then they transition into end of life. So these two are interchangeable. The only difference is the window is slim. So from palliative care, in most cases where you deal with pain management, and sometimes it's very quick, you enter into end of life. And so with end of life care, it deals with holistic things. As a medical social worker working in this field, you are in charge of putting all the different pieces together. You wear many hats. You provide support for the patient and their family. Again, you do pain management. So most cases, people in this category, sometimes they have kidney failures, they're dealing with cancer treatment that comes with a lot of pains. When it comes to kidney failure, they go for a lot of dialysis appointments. And so the goal here in this field would be to minimize the amount of time the patient goes into the emergency room, so ensuring that they have access to their medication and their reducing the amount of pain that they're in to promote quality of life for them. So as a medical social worker, you also provide sometimes physical assistance to the client. If you're working with them and they're in need, maybe they cannot walk, you are there to provide that support. Emotional support also, you also provide emotional support for the patient. Mental health, you um, connect with counselors if you're not satisfied to do that. That will provide counseling services for them. Spiritual support, if you're a social worker, you're working with a client who is rooted, grounded in a specific faith, and you need to connect. You will need to connect to a pastor or priest or rabbi, imam, whoever it is. You have to connect that patient so that person can provide that spiritual support to the patient. And therefore, for that reason, as a medical social worker or a social worker working in palliative care or end of life care, you have to be well rounded and knowledgeable about different cultures, different aspects of health insurance, the medical field, to be able to fully help your patient. Another thing that is done in end of life care is helping the client or the patient to set appropriate goals and also help them to achieve those goals. So maybe, for example, if a patient is at the end receiving end of life care and they had traveling around the world on their list, their wish list, obviously they're in a lot of pain, they won't be able to achieve those goals. But if they also had writing a letter to their children, their family members, maybe they cannot do it. You as a social worker, you ensure that you have all the legal authorities around, a lawyer, and you are able to help the patient to write a letter for their children or their family members. Maybe they are not in good terms with their family members or their children, and they're at the end of their life and they're seeking your support. You are able to connect them to those different family members so that they can mend things and hopefully depart in a peaceful way. So you provide counseling, you help connect the patient to counseling services as well, and also help the family members that is the family member present or the patient family member to prepare for the current, deal with the current stages of their family member that is ill, and also prepare them to transition to deal with grief in a healthier way. The next thing is how is end of life care, how this population different from other. Like I said, this population is different from others population because it deals with holistic different things, whereas other population are specific. With end of life care, you are the link between everything else. All the members within that patient care, you work with them. or the family members you work with them. You work with, you also have to have knowledge on the patient culture. So the big difference is that you have to be able as a social worker provide holistic services to the patient and their family. You are not dealing with just a person, you're also dealing with how to transition. So you care for the patient, you care for their family, you do provide support for your co-workers. Again, like I said, physical, emotional, spiritual, other counseling services. You also want to be able to know or have a knowledge about challenges and needs that face your population. So as a medical social worker or as a social worker working with this population, you must know how to have access, the different ways that one can have access to medication, especially for the homeless population, because they face a lot of anxiety looking at the fact that maybe when they were younger, they had a lot of history of chronic homelessness, chronic joblessness, poverty, and so for that reason, they may not be qualified for the best healthcare system. We are grateful that in the U.S. we have basic healthcare system that provides services for the needed population, most vulnerable population, but still there are times where patients have some illnesses that we need a social worker to go the extra mile to be able to provide all the services for that patient, because the goal is to reduce symptoms, emergency visit, hospitalization, since most of these patients, like I said, deal with cancer, kidney failure, and other illnesses. So they may need help to achieve, like I said, realistic goals. And as a social worker, your goal is to help them narrow things down that they are able to achieve, to help them, have a successful dignity, quality of life within that stage. Sometimes they deal with depression, so being able to provide that support system is important. Another thing is, how do we address those needs as a social worker? Advocate. As social worker, we must be knowledgeable and be able to advocate in whatever way, any way possible for our patient. So social justice issues, again, like I said, education, maybe when they were younger, minimum wage, things that we can do to stop the problem from the very beginning before they come. Just because we are not working education or we are not working in other social justice issues areas does not mean we cannot collaborate with our other social workers friends to be able to address these things, because later on in life we will work with these patients and it becomes a problem. Access to quality health, affordable housing, because you may have a homeless patient who's dealing with kidney failure, cancer, and they may not even have access, no means to healthcare services. So being able to advocate for those things at the initial stage before it gets to that point. Counseling services, like I said as well. Resources needed for social worker. Again, a social worker must be knowledgeable, know your different culture that you work within, the hospital where you work out, the agency, knowing their culture, medical, you have to have a knowledge on the different insurance policy, different treatment options, community resources and support system. You may have a client who is very grounded in their culture, but now they're in a facility, maybe a nursing home, hospice, or a hospital where they have no access to their culture. Being able to put those different pieces together to get them connected could also improve their mood and improve their state of life at that moment. Culture practices, maybe they used to practice other things, meditation, how to incorporate those things into their care plan. Collaborating with all the team members, community resources, have a basic life-saving skill, because you never know, even though you are not a medical provider, but you may be working with a client and something comes up. At least until the medical people can come there, you must have basic knowledge on those different things. Resources needed for the patient, again, ways that they have coped in the past with their ailment to help them reconnect, medication to manage their pain, options, I think this is one of the biggest things I've learned. There must be options for people that have chronic illness at the end of their life to be able to stay home and get the services that they still need at the end of their life. Because sometimes the bigger facilities, they make the situation difficult for people to heal or even live a quality, not heal per se, but live a quality life at the end of their life. Mental health is another need. So connecting clients, patient with mental health services, coping skills, like I said, community group support system to help them deal with emotional pain, the knowledge, the aspect of even transitioning out of this world. So just connecting them with those different services to deal with the reality. Legal aid, like again, if you are there to help as a social worker write a letter for a patient, you want to ensure that it is you are doing it in a legal frame of work. Also, ways to distinguish yourself as a social worker from your peers, utilizing your skills holistically, being able to wear many different hats other than basic case management, being able to coordinate different services, ensuring the patient needs are met once again, serving as a support system to the patient, their family, the entire medical team, and being resourceful is a biggest thing that I learned from my research. Be able to be resourceful not just to your patient but also to your co-workers and to the family. The question that I have for my peers is, what issues and challenges do we as social workers think uh, that affects the quality of inner life services individual receive, and how must we as social worker advocate for those issues to enhance the quality of life, even if we are not working within that field, especially for those faced with severe economic challenges like the homeless population. How will we collaborate to address those issues? In conclusion, other things that I talked about, as a social worker working in this field, you must be knowledgeable of a lot of things, know different system, different type of resources available, knowledge on culture, treatment options, ensure patient needs are met, connect with family to counsel, receive counseling services, provide support system for the patient and everyone else within the patient's life. Um, that is it for my presentation and my references that I gathered. I was also able to do extra research based off the information classmate provided from week 5. And so here are my references for my presentation. Thank you all. I look forward to learning from you guys' presentation as well. Bye-bye.